Chinese or English?
English.
English.
Chinese. Chinese.
A bit Chinese?
Yes, Mama.
Already? Ah, it's nice, I think. So, usually most of them stay in Chinese. How long have you stayed Chinese?
3 年.
3 years already?
3年半.
Oh, it's a long way.
已经3年半了。
Already
Yes.
3 years back.
对.
Oh, nice. So, how long will you keep?
还有2年。
还有2年. Altogether 5 years.
然后回家。
回家? China is okay. Stay here.
We're looking forward to staying here.
I think it's possible. We're looking forward to you stay here. We hope our city could be more international.
It will be very soon.
Like your face, it's nice, I think. Some of them we have met in operation room.
Yes, we did.
Yeah, I remember you, I think. Your beard. Yeah. So, I think we talk about hernia today. Our course could be hernias, peritoneum, and intraperitoneal abscess, I think. I don't know who such a stupid idea putting hernia and peritoneum together. It's absolutely different things. So I think most of the things we discussed today is hernia instead of peritoneum. So we also very briefly will introduce something about intraperitoneal abscess, which is more important in clinic. For the peritoneum, I think it's more basic science. We will learn something from the books, I think. Hernia is very, very important in clinics. You know, the surgery, I think the basic idea of the surgery, most of them is around the hernias, and it's also quite difficult for you to understand if you don't know something, particularly for the anatomy. Anatomy is very important in this section, so please do remember. I think I will first start something about the anatomy. You must be very careful about these things. If you know the anatomy, actually you have know most of things of hernia. It's very easy for you to understand it and follow it. But if you don't know the anatomy, you will make it quite dizzy. What's hernia? So let's start. So first is general consideration, definition of hernia. Actually, in English, hernia means a spiral prostruction. So today we talk about external abdominal wall hernia. Please remember the definition. It's an abnormal prostruction of intra-abdominal mass or tissue, part of the viscera through the opening or fissure defect in the abdominal wall. Please remember this definition is important. Most of them in the inguinal region or in the groin. The groin hernia is the major part of hernia. So we look back. This picture means from human being, there is hernia has been a human-specific disease. If you remember, do you have any idea that a dog or pig have hernia? No, they don't have hernia. There's never been a dog with a hernia there. It's impossible because we upright, we walk by our legs. So the gravity of our abdominal contents will down, and there is a defect somewhere. I will show you in the anatomy. So the gravity of the abdominal contents cause the hernia. So this is a human-specific disease. If the dog can walk, they also will have hernia. So remember. So long ago, we start to do something about the hernia with this guy. It's a very ancient, I think it's a Greek, maybe a Greece picture. They do something about this region. They try every method. I think this guy, just they find a mass in the growing region. It's a reducible mass, but they don't know how to deal with them. They don't know the anatomy. What they can do is use two ways. First is a truss. a belt. Maybe we remember in ancient Greek war, every general or soldier have a belt like this. They all have hernia. They use this belt to push and get chances to get the hernia knocked out. So this is one way. It's a conservative therapy. In modern medical science, it's a conservative therapy. So this belt, we call this in Chinese, we call this is hernia belt, like this. But we less and less put it like this. And another way, use surgery. But their surgery has to be very rude and tough. You just make an incision there, or even use some gel, or use something to make a very big scar in the growing region. And then the scar will grow and become tough. Then we think the hernia will not go out again. Actually, it's not so efficient. So this is the history of hernia. Sorry, I have to get the phone. It's very important. So now we start from home. I start from various kinds of hernia. You will see here a picture. It's a very interesting picture. Most of 75% of hernia is growing hernia, or inguinal hernia we call it. So they come out in this region. Please remember this region. But we have some other kinds of hernia, like here, umbilicus hernia. And this, in the epigastric region, we call this is epigastric hernia. And here, if you remember, you have a course called appendicitis last time. So this is a typical incision of appendectomy. So usually, any kinds of incision will have a defect of the abdominal wall. So the hernia, the abdominal contents, it's easy to go out from this defect. So this is a hernia from the incision of appendectomy. So usually you see here, this is epigastric hernia. This is umbilicus. Here, epigastric hernia. It's very rare. Actually, I think the human defect of the abdominal wall is not here. It usually is here. So here is about 75% of the hernia come out this way. So most of our anatomy and things will be discussed in this region. And here, let's have a look. This is a big incision hernia. The guy maybe have a major operation. I don't know what the operation is, but it go out. And I will talk about later, maybe the poor nutrition status or obesity is a very, very disadvantage of this disease. And here you will see, this is umbilical hernia. The small umbilical hernia usually occur in patients with hepatic cirrhosis, with massive ascites, and cause increased pressure of the abdominal cavity. So it will go out. Here is a bigger one. Here is a very large one. So and like this is very common in clinics, particularly Chinese HPV infection and a lot of cirrhotic patients. So we will have a total view. There are different kinds of hernia, like here epigastric hernia, umbilical hernia, incisional hernia, femoral hernia, and inguinal hernia. And sometimes there is other kinds of hernia. It's not so important, so I have not have time to talk about this. Okay, now let's turn to the most important part. We try to talk about hernia. That is the best. Yes, make it clear. So, why I show you the whole body instead of a growing region? Because I think the whole total view of the human body is very important for you to understand hernia. If I will show you a local part to make you dizzy. So please have a look at this. This is abdominal wall. Abdominal wall or here. The first layer is skin. I think it's easy. Then the second layer is subcutaneous tissue. Please remember here, this yellow one is subcutaneous tissue. The fat is just like a cushion. So make you, when you get some pressure or something, it's just like sofa. It's very easy to resist the strain from outside. So you must remember, this cushion, the subcutaneous tissue, have two layers. One layer, we call this is campus fascia. Another layer, the deep layer, we call this is scapa fascia. When you do operation later, maybe 1 year later, you make an incision, you will find the fat in your body have two layers. One layer is scapa tissue and another layer is campus tissue. So it's under the skin. There's such a layer, please remember. And then we turn to another one is very important. We remove the skin, remove the subcutaneous tissue, then turn out to be a muscle layer, a muscular layer. Very important muscle. We call this is external oblique muscle. The whole name is external oblique abdominal muscle. So this muscle is here. The lateral part is muscular components, muscular part, and the medial part is aponeurosis. Altogether, from here, we start in this region and stop in the inguinal ligament. Please remember, inguinal ligament is particularly part of the structure. Please note the direction of these muscular fibers. They just like with your hands in your pocket. Yeah, it's very important. This direction, and then they go to the medial line. It becomes the anterior sheath of the rectus abdominis, and then they go to the last part. I think the inferior edge of the abdominal oblique, external oblique muscle, it becomes inguinal ligament. Inguinal ligament. It curls, thicken, and attached to the pubic tubercle and iliac crest. These two structure and become a ligament. And this ligament is the border of the abdominal wall, the pelvic cavity, to the lower extremities. You know, here is the thigh, aponeurosis in the thigh. But you know, all the things actually they connected. They are not a separate structure. They all connected. Even into the scrotum or the perineum, they all have a very particular layer for every layer in the abdomen. So, you know, here as important structure, we call this is external oblique muscle. It's important for us to understand the hernia. So the epigastric hernia is from this way, and umbilical hernia from umbilicus. And here, this region is the inguinal region. So it's very important. Most of our hernia come out from this way. So we start to discuss. You know, we have to pay. Human beings have to pay for a lot of things. Pay for this. From here, we pay for our birth. The umbilicus is, you know, this is the umbilical vein, the artery, which is important in our fetal development. and we got nutrition from these two vessels, although it is paired in our when I grew up. But it's important to become a defect of our abdominal wall. Later, if we got disease, we will got hernia here. So we pay for our birth. And here, we pay for our offspring. You know, something passed through here. This is spermatic cord. In woman, it's that's different. So it's important, you know, the testicle and the spermatic cord pass through this region. So because of this passing through, we have a defect here. If no structure come out, it will just totally a mess. It's okay. I think there's no, even we are walking upright, it won't be a defect here. But since we have a spermatic cord coming out, there is a defect here. So it's a problem. So we have to pay for this. We will talk about this later. So please note here that aponeurosis of the external oblique muscle here form a ligament, and here, because the spermatic cord have to pass through, so this aponeurosis have to separate two crusts. One is the anterior, posterior crust. So here there is a hole here. We call this is external ring of inguinal region. External ring. So, and the other part was covered by aponeurosis here. So this is the structure. Okay. So we remove the external oblique muscle. We remove the external oblique muscle. Another muscle appears. We call this another muscle. This muscle have an opposite direction to the external oblique. It's internal oblique muscle. The direction is from down to upside. So here, the medial part also is aponeurosis. It composes part of the sheath of the rectus abdominis. And here, something different is in the inferior edge. It's not aponeurosis. It's still muscular part. We call this is conjoint tendon. Conjoint tendon. This tendon is also important. So we go back. You see. Go back. You see. Here, aponeurosis cover the whole region, and the spermatic cord come out, and then we remove the aponeurosis of the external oblique muscle. We find muscular layer of the internal oblique muscle here. So you know the whole can bigger. This part was covered by some muscular region here. This is conjoint tendon. It's a particularly very, very important structure we will discuss later here. And you know, this is spermatic cord. The spermatic cord become visible. Some internal part was visible here. So we turn to another one. We remove the internal oblique muscle. There's a transversus abdominis here. This muscle is transversus abdominis muscle. This one. This is the third layer of our abdomen. So other part is similar to the internal abdominal muscle.
Me. Students at the back cannot see the pointer. Can you use the mouse, please?
Mouse. Okay, it's nice. So should we repeat? Okay. Just use this.
Yeah, that would be.
Okay, that's right. So, you know, the transversus abdominal muscle is just very like to the internal oblique muscle. Just the direction is totally transverse instead of upside. So here you see the inferior edge of this muscle is also muscular components. So an internal oblique muscle and the transversus abdominis together join become a conjoint tendon. Here you see conjoint tendon. So when you remove the internal oblique muscle, you find nothing new, just another layer of the muscle. So when we remove this muscle, please look at this here. All the muscular layer have been removed. We find a new thing come out. You see, this is the spermatic cord here. Here we only can saw part of the external the spermatic cord, and here is the total spermatic cord here. And this layer of tissue, this is transversus abdominis, and this is transversus fascia. We call this is transversus fascia. You see here, transversus fascia. It's a very important part of fascia. You mean 3 layers of muscle was removed. There is still another layer of fascia. This is transversus fascia. And here we find an important structure. You see the spermatic cord come out from the abdomen. So we call this is internal ring. Another term is deep ring or internal ring. So you see here, actually our body is not one defect. In this region, 2 defects. Deep ring is another defect. If we remember, this is the external ring, 1 defect. Deep ring or internal ring, another defect. So actually, a lot of muscle and structure try to protect the spermatic cord, but they have 2 defects here. So please remember, it's really very important structure. So the inguinal hernia that we talked about, actually they go out in this region. They go out from this region. They go out along with the spermatic cord. Okay. From a total view, we have a close look at the inguinal region. Here, this is transversus abdominis. This is internal oblique muscle. They 2 together forms the superior edge of the inguinal canal. This is conjoint tendon and the spermatic cord. And here, when we remove the conjoint tendon, we will find out a deep ring here, and the spermatic cord go out from this way. And please remember another thing is, there's a blue, you see the vein, a very big vein and the vessel pass through. So we can imagine, please imagine, here is the aorta and the inferior vena cava. And the aorta and the vena cava go divide into what? Yes, iliac vessels. And the iliac vessels go downstairs, become femoral vessels. So the femoral vessels, when in the junction of femoral vessels and the iliac vessels, it gives a recurrent vessel. Small recurrent vessel is inferior epigastric vessels, like here, to supply the rectus abdominis. So it go up, go upside, go upward here. And this vessel, I think the nutritional status of this vessel is not important, but it's a very important landmark, for us. This landmark is here, the deep ring is lateral to this vessel. If you notice, here, this is deep ray, and here is another region I will talk about later. So please remember the deep ray is lateral to the inferior epigastric vessels. It's an important landmark in the operation. So we have another view. And this is easy, I think. I did not spend time here. It's just the inguinal region. And here, this is a picture from inside. We put our eyes into inside the abdominal cavity. Look from inside. So we can vertically, please remember, this is femoral vein, femoral artery, and give a recurrent vessels. This is inferior epigastric vessels to the back sheath of the rectus abdominis. And this vessel here is the deep ray, the spermatic cord in male and the vas deferens in female go out